Welcome everybody to today's webinar. My name is Rob Vinson. I am the Associate Administrator for Alcohol and Prevention Treatment Policy here at SAMHSA, Center for Substance Abuse Prevention. I'd like to just on behalf of Dr. Delphin Rittman, the Assistant Secretary for SAMHSA, to welcome you and appreciate you for joining us today. I'm joined by Erin Wick, who is the Senior Director for Behavioral Health and Student Supports at the Capital Region, ESD 113 in Olympia, Washington, actually Tumwater, Washington. As well as I'm joined by Dr. Amity Noldmeyer, who is the Associate Dean for the Graduate School and Professor of Education at Miami University. Each of them will introduce their respective staff. And as we move forward today, I just want to say thank you, and we're really hoping that these webinars are meeting your needs, and if they're not, please be sure and communicate to that. We will have a series of quick polls throughout that'll be dispersed, so just be aware of that, and we'll get started with that. Erin, if you'd like to introduce your team.
Good morning. Thank you all for being here. I'm super excited to share with you that today we have Izzy Chavez, who is our student assistance professional, serving directly the Hoquiam School District for us in the student assistance professional capacity. And also with us today is Sarah Ellsworth, who is our regional administrator for behavioral health and student support, and works at the administrative office, really just making sure everything goes off without a hitch. So thanks so much for having us.
And hello, everyone. I'm excited to be here representing the Ohio School Wellness Initiative, which is supported by the Ohio Department of Education and the Ohio Department of Mental Health and Addiction Services. So we're lucky to have two co-presenters here from those departments to share their expertise. So I'd like to introduce Emily Eckert, Assistant Director, Office of Whole Child Supports at the Ohio Department of Education, as well as Valerie Connolly Leach, Behavioral Health and Prevention Administrator through the Office of Prevention at the Ohio Department of Mental Health and Addiction Services.
Thank you very much, Amity. So today's session, we'll be building off of the previous sessions that we've conducted. So we'll talk today about conducting a needs assessment, some things to consider when developing student assistance policies, programs, and procedures. Walk through some of the ideas around staff development and training and some of the aspects around having a staff well-trained and ready to implement. Building program awareness and promotion ideas and how that's been implemented in each of the two respective states to help give you some ideas on what that might look like, as well as considering other partnerships that you may or may not have considered or frankly may have already been partnering with. But we want to revisit all of that as a part of schools and community. And so with that, we'll move to the series overall, and you might be reminded that we started with our first webinar series, student assistance programs, and moved into standing up those services. And of course, today's webinar is on assessing the needs and capacity building. If you can do the next slide, Dave. So we're going to move into our polling questions here for a minute. So this will be a fast poll. There will be a series of 4 short polls throughout the session today that'll help us learn a little bit more about today's webinar participants. Just be reminded that all the answers will be presented as totals or percentages, and really no one's name will be able to be identified, of course, unless you put your name in the chat box or attached to that somehow. And by answering the questions, of course, you're agreeing to have your answers posted anonymously as a total. And so if we can move to the next slide, Dave. And this will be our first poll. Now, it will be a quick poll, so please use fast fingers. We're only going to leave it open for about 15 seconds or so. All right, so it looks like about 17% are student assistance professionals, about 4% are educators, and many of you, about 65% of you are coalition members, and then we've got some other folks along the way. So thank you very much for that, Dave. All right, let me bring us in as a reminder, so where we're at. Student assistance services, in order for them to be effective as possible, researchers really have identified several components that we think are critical in providing services and reducing barriers. And you'll see the components are really built around the edges of that, where we're talking about school board policy, staff development, program awareness. And today specifically, we'll be focusing on school board policy, staff development, program awareness, as well as cooperation and collaboration, and then integration with other programs. Now, I also just want to mention that on the center of that is the alignment of those policies. And it's important to consider that as you're developing program and you're implementing programs as to what those services are going to look like, how they're going to impact things, what kinds of services you might identify as you're working through this process. And we'll talk a little bit about the SPIF, Strategic Prevention Planning Framework, in our next slide. So if we can go ahead and do that, Dave, that would be good. So let me just talk a little bit about the 5 components, because as you're thinking about the critical program components and looking at policy and those kinds of things, the Strategic Prevention Planning Framework really is a 5-step process. And many of you are probably quite aware of it, but it's worth saying as we look at this alignment, that what we're really talking about is helping identify the needs of the school district and the community as a part of that, and really relating that to the substance use and mental health issues. Schools are involved in strategic planning all the time as a part of curriculum development and school culture and climate issues, but we're focused here on really more the behavioral health and the preventive nature of these things. It's also around building capacity, and that capacity is really critical to the success of your student assistance program and service. It can be strengthened by really looking very closely at the assessment data, finding those gaps, and then finding out what lies within those gaps. Where are the areas, the bright spots that are going underserved within that? The components of capacity building are really, sometimes you will hear us refer to this as a piece around readiness to benefit sometimes. But that capacity is absolutely critical. Even though I want to implement something sometimes, I may not really have capacity to do it well. And so to quote a good friend of mine, Dr. Michael Dennis, sometimes the best thing you can do is the simplest thing you can do and implement it really well. And doing so, you'll have good outcomes. So if we can move us on to the next slide, Dave, that would be great. And this will, I'll turn it over to Dr. Amity Noltmeyer to take it from here.
Great, thank you. Well, as you just mentioned, Rob, assessing needs is really an important component of that 5-step strategic prevention planning process. So before we start thinking about planning and implementing supports, we really need to understand the school, district, and community needs related to substance use and mental health. And more so than that, we also need to know what resources and capacity for services already exist to support promotion and prevention, intervention, and treatment. So that's really what a needs assessment is all about. If you want to switch to the next slide, that'd be great. So in the next few slides, we hope to share 2 different examples of needs assessments in action, one from Ohio and then one from Washington. So I'm going to start with the Ohio example, and this is more of a state level needs assessment, but I'm going to draw us back at the end to how, it's the same type of process that could be done at the local level in the school. It just may look different in terms of scale and scope. But I think that the information hopefully can be applied to those settings as well. So this is work that we did for the Ohio School Wellness Initiative, which I mentioned at the beginning. And that initiative really aims to successfully implement and sustain student assistance programs, as well as staff wellness programming. But today I'm just going to focus on the student assistance programming needs assessment. So as part of that, we did create an assessment. Now I'll mention that in order to do a needs assessment, you may have existing data that you can use for that as well. But we chose to also implement a survey to gather additional information. And so we created a needs assessment in January 2021 in collaboration with the Miami University Discovery Center for Evaluation and Research and Professional Learning. And our goal was really to learn more about the substance use and mental health needs that school staff were seeing in their students and in their schools, and also if and how those had been impacted by the context of the pandemic. And then we also wanted to know about existing SAP readiness and implementation, as well as barriers. So what was happening in terms of SAP implementation at that time. And so we really wanted to use the needs assessment results to inform the development of resources and ongoing coaching and training and other types of support that we could provide to schools to help them successfully implement and sustain their SAP. So as you see here, we administered the needs assessment. We started in May 2021. It went through July 2021. It was administered to individuals in the schools that were participating in our Ohio School Wellness Initiative, as well as a small stratified sample of other Ohio schools. So in all, we had 116 schools that participated from across the state. So if you want to go to the next slide, that would be great. So what do we find and how do we use this data? Well, today I'm just going to mention a few highlights because there's 29 pages of report. So I don't think we'll get through all that today in the meeting, but what you see on the screen are just a couple of images, just a couple of examples of the types of information that we glean through this assessment. So for example, on the left, you'll see some of the student needs. So overall, we found that in the schools, the highest levels of concern for students were depression, anxiety, attention, hyperactivity, that's those sorts of things. But when we looked at how the needs had changed since the start of the pandemic, we found increased concerns in areas such as you can see, social isolation and grief and loss and trauma and suicidal ideation. So this helped, some of the items around these student needs helped us to see, what were the most pressing needs and which were, suddenly kind of appearing at a higher incidence. We also looked, the data also showed that all those schools had some initial components of student assistance programming in place. This is at the beginning of our initiative. So there were many components that weren't implemented by schools as well. And the needs assessment data really showed us what some of the obstacles schools perceived is, what some of the factors that schools perceived as obstacles to implementing SAP programming. And so it's a little hard to see, but what you'll see is the needs assessment data indicated that some obstacles were lack of resources for staff training, staffing resources for interventions, time, factors like that. So it allowed us to see what those obstacles were. So based on the data that we collected through the survey, which again, these are just 2 snapshots, but we also did a resource we looked through other existing needs assessments throughout the state. We did a resource audit throughout the state to kind of see what resources are already available. We gathered stakeholder feedback, and basically we did what we called a gap analysis, where we identified, okay, here's what the needs are, here are the resources that are already available, here's where the gaps are that we need to develop resources or supports or training that will facilitate the implementation of a student assistance program model, and tried to make some actionable plans to address those needs. So that's how we did the needs assessment. And even though, like I said, this is an example at the state level, but the same type of needs assessment can also be replicated within a school or a district. It may be using different data sources or a different scope, but basically surveying what are the needs, what are the resources available, what are the implementation barriers. So I'm going to now pass it over to Sarah, who's going to share an example of something that was done in Washington related to their readiness to benefit assessment.
Thank you. So Washington is in a little bit different place than Ohio. Student assistance programs were established, I want to say, in Washington in 1998. So we're moving into well over 20 years of implementation. And as part of that, we don't have student assistance programs in all districts in the state, but we do add districts each year. And so part of the process is looking at data, just like they have in Ohio, and determining where is the need, and then talking about readiness to benefit. So this is just a snapshot, again, of something that we did in Washington with our most recent expansion. And this is 2 different counties. Obviously, the schools have been removed for anonymity, but the dark colors are looking at data and looking at data that's elevated both for the state, for their region, and for their county. And those districts become prioritized. So this is, again, step 1. What is the needs assessment? Where is their need? And you can see here, obviously, some clear trends emerge. This district right here, I don't know if you can see me scrolling, the second district down has some real elevated needs, both in terms of their behavioral health data, as well as some of their other academic data. And so that would be a district that we would want to look closely at. And the next step with this process is to look at what is their readiness to benefit. So do they have infrastructure in place that would allow student assistance programs to come into their building? And these are really simple things. Do they have a space for a student assistance professional? Are they willing to dedicate some funding to that student assistance professional? Do they have a group who is going to form a coalition and support the community engagement of the student assistance professional? So I think that the picture here is really, we start with data, we look at needs, and then we start to evaluate what is the readiness to benefit, because what we know, and probably what you are finding in your implementation as well, is that often there is a need, but if there's not the infrastructure, we can pour all the resources that are necessary into that specific space, but if it cannot be integrated and well organized, it's not going to be successful. And so really wanting to marry that need with that readiness to benefit, to have successful outcomes within a program. You can move on to the next slide. So the other thing we want to talk about is, once we've established readiness to benefit and we've identified sites, we need to develop policies, procedures, and practices. And I think it's really important that we talk about policies and procedures, which are those written documentation of how we're going to approach and address issues. And then practices are, what are the actual implementation steps that we're going to take in the real world to carry out these policies and procedures. Because everybody's coming from different places of readiness, different places geographically. We just wanted to talk about some things to consider. So first and foremost, the state and federal regulations and laws that you must comply with, because your policies and procedures are going to need to speak to those and be in aligned with what's expected from you legally. And then once you've established, okay, this is the framework and these are the laws and where we need to be compliant, what are the policy and programmatic level considerations that you want to think about? So how some of the things that even between Ohio and Washington that are different is, our student assistance programs are run through educational service districts. So we are external entities to the school districts that we serve, providing student assistance within their buildings. And so that means we have our own set of policies and procedures that are external to the school, but need to be aligned, obviously, with district expectations. That's going to look very different if you're operating within a school or within a district. And so part of our process is, again, looking at what are we expected and required to do? What are we trying to do programmatically? How do we align that with what the school's policies already say? And then we create our policies. And if you move on to the next slide, we have an example of what that looks like. So this is our suicide risk screening, because one of the things that we come across frequently in student assistance programs is young people who are experiencing high levels of distress. This has been increased during COVID, during the pandemic, and I'm sure that this is something that you've seen as well. And so we have a formal suicide screening process that is shared with our districts, that's done by every student assistance professional in the very same way across our student assistance programs, because we want to ensure that first and foremost, the safety of students is what we're prioritizing. And so the left side of your screen, as you're looking at this, is a copy of our policy. The procedure has been left off just for the purposes of space, and the details aren't that important, but we always try and embed our policy and why are we doing this? And then anytime we write policy, as specific as possible in terms of what the steps the SAPs are going to take. We train to these, but oftentimes those of you who are working in this role probably recognize I get lots of policies and procedures. I have lots of things I'm expected to do, but oftentimes until I'm in the situation where I need to do them, it's very hard to remember what to do in specific situations. And specifically with suicide risk screening, that happens often enough that we want our staff to have a policy in place, but not often enough that they're doing this every day in most schools. And so being as clear and specific and precise, so that this is considered the service as a screening. It should be done with an individual or their family member if possible. It should take no more than 10 minutes. Here are the people that should do it within our system: student assistance staff. The participants would be any student who's seeking our services who report suicidal ideation in the past year. That's really important because we found, especially during the COVID pandemic, if we shorten that time frame to within the last month or within the last 6 months, that we were missing students who were at risk. So we wanted to extend that time frame to a year. And then our goal is to identify youth who are at risk. And then the right side is the suicide screening tool, which is a modification of the ASQ or the ASK tool that was developed by the National Institute of Health. The only thing that we've really changed is we've localized our resources. And again, wanting all of that to be on one piece of paper for our staff. So we have a policy and procedure that's written out step by step, and even within the tool, prioritizing that procedure so that staff are ensuring that they're able to follow that as closely as possible. You can move on to the next slide. And the next slide is a polling question. Again, the poll should pop up for you. You'll have 15 seconds to answer. And when you're done, I'll briefly share the results. Okay, so the question is, do you currently have an active SAP? It looks like about half of the participants do at 48%. No for the rest, in varying levels of we used to have one, 5%. We're currently in the process of developing one, 9%. No, but we plan to develop and implement about a quarter, and then no, and we don't have any plans at this time, about 14%.
So another key component of your substance or your student assistance program is staff development and training. Staff development training really provides all school employees with the necessary foundational pieces of attitudes and skills to really reduce risk and increase those protective factors within their schools to really foster that resilience within their students and staff. It really needs to be customized to the culture and local conditions of the school and the community. And based on that needs assessment, really taking a look at that thorough needs assessment to identify what some of those needs are and focus on reducing barriers to learning. Our staff development also really needs to incorporate support for faculty wellness, which has really been a key component in Ohio, is developing out a framework for staff wellness. And also information about community resources for high-risk staff whose work performance may be negatively influenced by personal issues. And some things to really consider, you'll see there on the slide, there's a lot of components to think about when you're looking at staff development to ensure that your staff and all school employees are getting everything that they need. Next slide, please. So it's also important to look at various themes that may appear within your data and think about how we develop our trainings and supports for staff that are, different modalities that really help build the knowledge and skill base that they can apply what they're learning, that they can learn from each other as well as peer-to-peer learning. And some of the key themes that we have seen are reducing risk and protective factors, working with those community partners. That's so integral to this work, and helping our community learn as well and how to connect with schools and vice versa. So yeah, those are some really the key pieces of staff development. Next slide. So in Ohio, we've developed a roadmap for our pilot schools that will then be made available, to more schools as we scale up. That it contains various foundation and levels of learning, as well as different modalities. So you'll see there's foundational components. We really support the community of practice approach in this work. We have regional opportunities for folks to engage in for support and ongoing learning. There's online platforms that are self-paced that staff can access, and we continue to refine and build and create new resources really from the feedback that we're getting from our pilot schools, is really helping inform other needs around staff development that we can help support from the state perspective. And now I'm going to pass it over to Sarah and Izzy.
So when we think about staff development, there are two levels of staff development that we like to think about. One is, what are the foundational trainings and supports that our student assistance professional staff need to implement in a building? And what are the foundational trainings that our schools who are receiving these services need to be able to integrate these services into their existing programs? And these are just some examples of the types of trainings that we offer both to our schools and to our internal student assistance staff to initiate programs and make sure that services are aligned and everyone's on the same page. So those foundational trainings that both school staff and our student assistance staff would get include the student assistance framework. So helping really identify what is the role of a student assistance professional and how can be integrated within the system. What role are they there to serve? Many of you, it sounds like, are working in student assistance programs. And without this framework of understanding, we're often asked to do things well outside the scope of what it is we're actually in the building to do. And so really front loading the expectations in the framework and helping ensure that schools are on the same page as us with what that looks like is really important. And the other key component is multi-tiered system of support. In Washington State, there is a large collaborative effort at this point in time to align not just the work we do on the academic side, but also on the behavioral side within a multi-tiered systems of support framework, and really helping schools, again, understand that framework and how student assistance fits within that framework. And then this is important for our student assistance staff too, who are also often coming from a background that's not within education, maybe a social service background or a behavioral health background, and helping them understand and align language with schools. I think that that's one of the really important parts of training as well, is how do we align language so when we talk with our schools about our services, we're using consistent and common language that means the same thing to everyone. And then foundations of our program include motivational interviewing. So really embedding our student assistance staff in that way of being with students. We use cognitive behavioral therapy as a framework for a lot of the work that we do, and also training on specific interventions. Brief intervention, teen intervene is just an example of a specific brief intervention that our staff would utilize with students. So again, just thinking about how this might apply to you are what are the foundational and framework pieces that both your schools and your student assistance staff need, and then what are the implementation pieces and practices that your student assistance staff will need to employ within a district and plan for training around that. Next slide, please. Oh, another polling question. Again, we'll post the poll. You have about 15 seconds to answer and we'll share the results. Okay, results. It looks like most of you, 80%, heard about this through the Talk They Hear You e-newsletter or e-blast, and then the 20% are other. Here's what the other is. Next slide, please. And then when we talk about capacity building, so we want to think of that in three large buckets. How do we create program awareness and promotion? The first step obviously is that agreement and that collaboration between a school and a district, but we also want the community, and both the school community and the larger community, to know that this program exists so that students who are in need may benefit. How do we build in cooperation and collaboration both within the school and community-based partners? And how do we integrate with other school-based programs when there's natural overlap? Next slide, please. And so these are just some examples, I think, that both Washington and Ohio has utilized to share about the program. So these include things like disseminating program flyers through the school and local community, posters and newsletters, community awareness and training events. During COVID, that's a lot like virtual Zoom events where parents and students can participate, including it in parents, teacher, student, and teacher handbooks. Conducting homeroom presentations and using media outlets. I'm sure that there are plenty of other examples, but these are ones that are based in implementation science and also known to be effective ways to share programming. And the next slide is an example of one of the handouts that we've developed. We call this our student assistance postcard. There's a front side that has a little bit more information, but basically just we are here to help how to contact our student assistance programming services, our website, and then also sharing emergency crisis resources for families who may need immediate support or immediate connections. So we have our crisis response dispatch for our region, as well as the National Suicide Prevention Lifeline and the crisis text line. and that really cool QR code links to some resources on our website for families to learn more about our program, and also things that they may be able to do in their home to support their students' mental health, or steps, tools, and activities that students may be able to use to support their own mental health. So again, part of this is embedding the student assistance within the larger community and the larger school community, that we have a role with helping students if there's something they need beyond and there's immediate contact, making sure that they have that information that they can get. And if they're ready to take steps to help themselves, to have some information about that as well. Next slide.
Just some examples from Ohio as part of the School Wellness Initiative. We've developed some tools for schools to utilize as they think through how to promote their programs. So there's templates, there are brochures that they can customize. PSAs are being developed that target different audiences, starting with youth. And some of our schools have hosted day-long events, mental health events, where students have the opportunity to come together with their teachers, have conversations around mental health, talk about what they want within their school, what they want from their teachers in regards to mental health and wellness. But then some of the challenges that our schools have talked about is figuring out, like, what's the appropriate amount of information to share and to with who. So some of these tools that have been developed can really help them think through the different audiences that they need to promote the program to, and what information is best for that audience as they develop the awareness tools. So with that, we'll go to the next slide, and I think we have a poll question. So you got a few seconds to answer this one. Okay. Did you attend SAP webinar 1 and 2? So it looked like 66% did not attend either. Some attended both at 15%. Webinar 2 was at 9%, and webinar 1 was at 9%. So with that, I'm going to pass it over to Emily.
Hi, good afternoon. Next, we will give an overview for how cooperation and collaboration can help build capacity. It's essential to build bridges and partnerships with schools, families, and the community. And some of the ways that this can be done are listed here. Community agencies and counselors can provide assessment, evaluation, and counseling for concerns that present within or outside of the school. Caregivers, communities, law enforcement, and private practitioners can help schools with prevention activities, consultation, and other forms of support. And regardless, caregivers and the students themselves must be key partners and are essential to the services of all student assistance programs. And having their involvement and awareness of services is key even before the services begin. So for example, Valerie had shared about the PSAs that we're doing, or other things to create that awareness at the beginning, and that buy-in, and helping them understand what's happening from the beginning, and so that they are key partners in that success. And in Ohio, some schools have had brainstorming sessions and team building activities within the school team. And some send caregiver letters in which parents can opt in or out of that communication. And with the pandemic, one school changed how they're communicating with their caregivers. So specifically how they structure their emails and calls, the number of calls that they make, and the information that they disseminate on the calls, and also how they structure letters to really embrace mental health and wellness. Next slide. When looking at best practices in Ohio, here are some of the things that can be reviewed. And the things that we will, that are listed here are part of Ohio's drafted fidelity checklist. And it's essential to make sure that those community linkages are explored in the ones that are needed. have happened. And any community partners should regularly participate in program meetings. Relevant community service organizations working with the students receive information concerning the programs and services offered. Guidelines on caregiver and student involvement are set, and those are in place. And when we asked Ohio schools about some of their successes and challenges around cooperation and collaboration, one noted that they had success in establishing a bi-monthly meeting where the SAP team, where the student assistance program team comes together and they collaborate and decide on a task from this fidelity checklist. So they pick a task from here and they use a divide and conquer plan and approach and develop a time frame for that to be established, for that task to be checked off. And so, for example, in one of the instances, they created a database of resources to help staff and parents know that the community programs that were available. And they found that this was a very helpful way. And with the buy-in and the collaboration of all of those people, they were able to develop a better database. So it is not just important to establish those partnerships, but to see how they're going. So evaluate them and assess how they're going. Doing this early and doing this often is essential. So identify a time to meet with the collaborators specifically to discuss what's going well, what can be improved, and the priorities moving forward. And again, having these conversations early and often with the team and including school staff, community partners, and parents to identify the successes and barriers. And this takes us to our next piece, which is integrating other school-based programs and why this is important for capacity building. So for those of you that were not new to this webinar, you'll notice that this was a titles of slides in the first two webinars. And when we were discussing this in preparation for today, we decided that it is something essential to keep plugging in and to continue mentioning in these webinars. And the reason for this is to strengthen and build the school's capacity to support the needs of all students. So after completing the needs assessment, consider if the school might benefit from incorporating any additional student services into the program. And integrating the student services with other school-based programs designed to increase resilience, increase academic performance, and reduce student risk for alcohol, tobacco, or other drugs or violence. And through the school improvement process, each school and community needs to assess the services that best meet their own needs and the unique population. So this list on here shows many of the examples. It's definitely never limited to these, but a few of these examples include prevention curriculum, parent education, conflict resolution, or violence prevention, to name a few. When integrating a student assistance program with other school-based programs, it's important to identify the connections between them and among the existing programs and initiatives. So last, in webinar 2, we listed out what's currently using the Working Smarter table. We can look at what teams exist, what's happening, the goal of the teams. And that's just one way to do that. But regardless, taking a look at identifying the connections among existing school-based programs and initiatives, and then seeking to build depth and quality systematically in a multi-tiered system of support by providing more targeted wellness supports, and specifically services in tiers 2 and 3. And designate liaisons from each problem-solving team to facilitate that cross-team communication efficiently and allow for discussion regarding student referrals. So making sure that all of the teams are talking and that everyone is working in an integrated, collaborative way rather than in silos. And we asked some of Ohio's schools about successes related to integrating other initiatives, and one responded that because of their already established multi-tiered systems of support, it really helped with the continuity and familiarity of procedures when they're collecting data for their student assistance program. So it's like they already had an in there. I will go ahead and turn it over to Izzy.
Hello, everybody. Just wanted to give you an example of one of the ways that I've been able to integrate a student assistance program in partnership with what we call the Hoquiam Hope Squad at the Hoquiam School District. So it's just become a natural connection and collaboration, being the student assistance program and working with students and doing screenings with the Hope Squad, which is a suicide prevention team of peers, and they get trained into identifying other students that might have issues and needs around mental health. And so these students are able to identify and learn more about the resources, one of them being the student assistance program. So oftentimes I get referrals from these students that are trained into identifying and understanding mental health in a little bit more depth. And they are the eyes and ears of the school. They are able to see and hear things that us as adults aren't able to see, especially around social media and online outlets. So students are able to identify and know what the resources are in the school, and naturally doing screenings with students, whether it's substance use or mental health screenings and suicide prevention. It's become a natural fit. And to explain this picture real quick, annually we have a fundraiser for the local food banks, and one of the fundraisers was a volleyball tournament. And so we put together a Hope Squad team to compete. We did not win, unfortunately. However, it was a lot of fun, and we got to get our name out there. Other students got to see our faces, get to know us a little bit more, and that's the goal, is for students to get comfortable with the students, to be able to approach these students in these conversations that might be really difficult. So, and we know that students are going to be a lot more comfortable talking amongst each other about these issues. So it's become a natural collaboration, and it's worked out very well for us.
Well, thank you, Izzy, Emily, Sarah, Amity, and Aaron, and Valerie, for all of your great words of wisdom. I could not appreciate both Ohio and Washington State and all of your expertise as we shared today with coalitions and folks viewing today's webinar. I did want to just mention before we move into this, given what we saw in the polls, that all of these webinars are recorded, and that you could go to talktheyhearyou.gov and you will be able to find them under the educator section of the campaign. And so you'll be able to go back and visit, should you want to do so, all of the webinars in the 5 series and be able to catch up if that's the case for you. So we have a kind of a question and answer period here. And I'd just like to open up the mics, and you can ask a question of any person that you would like. I did notice one question in the chat, so let me just cut to the chase. We'll be happy to make PowerPoints available, but I'll need to check with any of the authors here on some of their work to make sure that it's okay to share with that. But once we've gone through that, we'll be happy to share upon request. So you can just send us an email beyond that. And Dave will put an email that you can do that. We've got an email that you can send that to us, and we'll make those requests. So with that, let me open up mics and check the question and answers to make sure we don't have something else there that we want to talk through. So I see one from Gina Brodowski. I'm sorry if I'm butchering your name, and I just want to read your question. This is my first SAP webinar. I think it would be good to define what an SAP program is in 2022 looks like. I know there are some embedded in schools. Some are external. Some schools are performing pieces but not calling it student assistance. I feel like I might have missed the first chapter of the book today. Again, I would say there's a couple of things that you can do. All of the SAP webinars are on the Talk They Hear You website. You can get to that by just talktheyhearyou.samhsa.gov. We'll put the link in the webinar. But I think Washington State and Ohio both have websites up as well that you could get a sense of the different flair. Let me just talk a little bit about what our intentions were with the webinar series, just to help you out a little bit, Gina. You are exactly right that states call these things a lot of things across the nation, and there are different parts and pieces of these that are being implemented in a lot of different ways, which is one of the reasons why I've always referred to it as student assistance. Because whether you're a school-based mental health center or a school-based health center, or an individual practitioner who's on contract from a district who is working through maybe some serious issues because the district had a need and felt like they need to do that. It's very difficult in the languages these days, which is sort of why I've always chose this particular language, so that it just allows to fit for people. What I really want to say about all of that is it's just important to recognize that our schools and our children are in need in many cases, and that there are a lot of variations of that. We are not trying to subscribe one model anywhere. It's one of the reasons why we have Washington State and Ohio on. Washington State's a very mature student assistance program that's gone through its own evolutions over the last couple of decades or so. Ohio is actually has been around much longer than what one might assume in terms of its, if you will, its parts and pieces. And I don't want to speak for Ohio, but it's a great example of they're going through a very formal implementation right now, which is a slightly different perspective. So let me open that up to our guest speakers here today, and if you'd like to chime in on that or speak to that in any way.
Sure, I could chime in briefly. I'll just acknowledge that it is correct that in one of our prior webinars, in fact, maybe two of them, we did talk about different service delivery models. So more of a school employed provider model, more of a community-based provider model, and core team model, and may have even covered some other variations. But in Ohio, we did, as part of our needs assessment, ask about, for those who said that they were implementing an SAP at the beginning of our initiative, we asked what type of model they were using, and it was varied, which I think is, and I'll let the folks in Washington speak to theirs, because I think it is a different approach. One thing that we are doing with our Ohio School Wellness Initiative is basically acknowledging that in the way that we're implementing it, that school leaders should consider the advantages and disadvantages of, or school leaders and community partners and everyone, of the three service delivery models relative to their own local practices, needs, and resources. So they may have a single service delivery model, or it may be a combination based on, a very careful consideration of the expertise they have access to, the resources, the availability of community supports, the funding, and all of those different things. So there's not a single, and Emily or Valerie can jump in if they disagree, but there's not a single model that is adhered to by all of the schools participating within our Ohio School Wellness Initiative. It's kind of customized and tailored.
And I'll talk a little bit about that as well. So I guess what stuck out at me is the 2022 student assistance programs in 2022, right? And so even those of us who have been providing this service for over 20 years, we're stepping back saying, how do we do this in a remote environment? How do we adapt this model? The beauty of student assistance service is we have a history of a framework and a bedrock that allows us to adjust and adapt our sales with the environments that we're dealing with. One of the best tools that's out there, and I think it was dropped in the chat box, is the Administrator's Guide for Student Assistance Programs. And especially for those schools where you're feeling like there's student assistance services happening, but maybe they're not coordinated, those are really great opportunities to use that guide and go talk to the building administrators and just say, hey, you're already doing all these great things. Here's a way we can scale this or add a service or develop it even more. And so I think it's just a good opportunity to have those conversations if you have pieces of it happening. For us, having done this for a long time, the best way to start is to just get started. If you have funding for just the prevention tier 1 supports, get the prevention tier 1 supports in, start building the infrastructure, start getting your partners and your collaboration people in place, and prove the value of being there and being a good partner and providing those services. And then the rest will naturally happen. Pretty soon you'll be doing tier 2 services, and then you'll be licensed and providing all tiers and providing really great services at a school district level, potentially remotely, potentially with telehealth, potentially in person. So that's my take on it.
And I think it's worth noting, I would just chime in, when ESD 113 first started, they weren't a licensed treatment program, and over the years they became licensed for substance use disorder treatment and mental health services. So, you know, I'm not suggesting that everybody start there. That's a big lift and an awful lot of work, to echo Erin's words. Good to start with the simplest thing you can implement well and see how that goes and find your partners. And, you know, I would just add something that I think Emily and Valerie had both noted, that, you know, in your partners, as you go through your selection and as you look at your regional capacities, you already may have a licensed entity that's very capable. Well, you don't want to duplicate those services. What you want to do is bring those services into the fold where appropriate. So with that, let me make way for Sarah here.
You know, just like Erin, the part that jumped out at me is, what does this look like in 2022? And one of the things that has been an evolution of student assistance in Washington State in 2022 that I think is really exciting, like many of you, certainly the scope of student assistance services has been limited based on funding. And so although we've been doing this for well over 20 years, our student assistance programming has really been focused on substance use prevention, early intervention, and then we add the element of tier 3 treatment. But with COVID, there have been emergent opportunities, because just like you're finding, students don't come to us in a vacuum. They don't come to us with siloed issues that need to be addressed. And so student assistance is really expanding its framework within Washington State to address the whole child and to address all of behavioral health. And so we're adding elements of that mental health promotion and awareness, early skill development for good, positive mental health, and early intervention for mental health issues. That is really exciting and has been somewhat limited in Washington State until very recently.
Well, and I'm glad you brought up the what does it look like in 2022, and I would just finish this one out with programs that stay static tend to not last. The needs of children, communities, and schools is ever changing. And so it forces all of us into being present, mindful, and participating in that ongoing needs assessment and working with our partners to figure out how we adjust and adapt and evolve. And all of that really does center around good data, meaning what are you looking at in your data? How are you collecting data? How are you evaluating your programs? And I don't want to overemphasize that, because I know evaluation is a thorny issue depending on what you're doing, but it is very critical to understanding where you've come from and where you might need to go. So I would certainly thank everybody for that. Doesn't look like we have any other questions, but I will open up the mics. If there is a question, if you'd like to just ask it verbally, feel free. And if we could go to the next slide briefly, that would be good as well. So I think Erin and Sarah had spoke to the Administrator's Guide for Student Assistance. And so you can get this off the web. I think my colleague Nell Nadal might have put it in the chat, so thank you for that. And if you want to go ahead and I'll just identify some resources as we're about 5 minutes out here from our final time. So within the Administrator's Guide, you'll, as Amity had spoke to, we were trying to identify various models and some of the merits of some of those models across the nation. So we'll be able to give you a little bit of information that way that you can look at that may be useful. Hopefully it is. Let us know. We would love to hear your feedback on things as you grow and develop and do your implementation. Dave, if you could move us to the next slide. As a part of the national media campaign, Talk They Hear You, and I say media campaign as a part of the national campaign, Talk They Hear You really is a multifaceted approach and campaign Our goal here was always to align public health messaging with interventions for parents, schools, and communities. And so in doing so, we've created really a series of tools very particular to student assistants and to educators. And one of those is sort of the student assistance resource guide. So this will give you the materials we've developed to date that are in the public ethos that you can use. And they're really there to provide extra resources in more of a tangible way. We're trying to be very focused on what would be useful to you in the classroom or in the school building. If there are thoughts or ideas around the next generation of things, please feel free to offer those up. We, as a campaign, build materials to assist you. So everything we've built to date has come from some coalition, some community member, some school, or a parent or a caregiver as we've developed. Also, this guide is really to help assist school leaders and student assistance professionals and teams in how to increase awareness of their student assistance services, and really to provide some guidance and resources along that way in terms of this critical work. So if we can, Dave, if you can move us to the next slide. In that, one of the things that we created is about a 9-minute video. It's what we refer to as a discussion starter. And the discussion starters are meant very much like our conversation today. We just wanted to walk you through what it could look like and some of the issues in a school, why you might want to consider that. And so this is a video that you could show leadership in a school or those kinds of things if you're having that conversation and you're trying to implement programs, why it would be important. And we follow a young lady and her friends through a little scenario to maybe identify why each of these people are kind of important, why nobody really is an island, and it takes everybody in those communities and in that schoolhouse to really help children thrive. If you can go to the next slide, Dave. We've provided some other helpful resources, and we'll put these up, and I just want to thank Ohio and Washington for offering up some of their resources as well. You know, there's room at the end for everybody, and I just want to make sure people understand that. Sometimes in developing these programs, people can feel anxious about a variety of things, and so really the goal here for us is to create a big tent and to help people understand that schools and communities and children probably need us more than ever, and that the more we come together to do that, the better it is. And here's some examples, both from Pennsylvania, Prevention First Guidebook. Ohio's offered up some of their needs assessment stuff, which is really critical and really well done, folks, as well as some of the school-wide universal screening guidance. Dave, if you want to move us to our next slide. So what's coming down the horizon here? So webinar 4, we're going to talk more deeply about planning and implementation. What that means in terms of getting quality implementation, what it means to set up internal referral processes, because sometimes this is where some of these things break down, is we might have a resource in a building, but we didn't adequately talk through how we were going to utilize that resource. More importantly, the biggest crime I can think of is to have a very qualified person sitting in a building that nobody knows about. So we have an underutilized resource, and that's hard for the person sitting there because they came there to do work, and they you know, I know very few people that are in this field that don't want to be available and help and assist. So this really is to help identify that, for one, so it goes smoothly, but it also takes care of a couple of things that Amity and others have spoken to, like sort of what kinds of information should we share, because not all information really should be shared. What are the limits of confidentiality, or some state laws in some cases, mandated reporting, some of those kinds of things. Secondly, what kinds of direct services do you think are important? What's come out of your needs assessment? Before you select a program, you really want to go through that 5-step process to make sure that before you make a selection, that it's the right program for the school. It's the right program for that particular population of children. And that you have capacity to do that. As Sarah had spoke to earlier in the conversation, sometimes that readiness to benefit really becomes more important and more central than sometimes we think. Lots of us went to the latest training and went, oh, I think I'd like to do strengthening families in my schools, only to realize that, oh, there are 6 other providers doing the same thing. Maybe I need to focus on something different and not, you know, there's 35 kids in the region that are coming to this, and now we've tried to split those 35 amongst the 6 of us. Well, that doesn't seem like a good use of our resource. Lastly, understanding risk and protective factors. Making sure that you have a deep understanding of that and what that might look like, and then how you're addressing that, how you're in your planning and implementation, how you're planning for that. How are we increasing protective factors and reducing risk factors? With that, our next webinar is going to be February 23rd. Sorry about that, 22, that would be a typo. We look forward to your participation. We would also welcome any suggestions along the way. So if there is a thought on something that you feel like you need or would be particular of importance for that, please feel free to put it in the chat. We would be happy to address that in our planning process to include it. So with that, Dave, you want to take us out to the next slide here? We've got our final poll. And if you would be so kind. All right. I want to just say thank you, everybody, for your time today. I realize I'm a minute over, so my apologies. You're always welcome to send us an email. Follow us on all the usual suspects, Facebook, Twitter. You know, we're in all of those spaces with the campaign. And if you want to get more information, you can go to that little, it's EEPUREL. That is our MailChimp, and that'll give us spotlights. And you can sign up for the newsletter, and that'll put you on our distribution list. So with that, thank you very much. I want to just thank my panel and our special experts and guests today. Each of you are amazing people doing great work, and I just couldn't appreciate you enough for that. Thank you very much, and we look forward to seeing you at the next webinar.